Hola amigos, hope everyone's doing great. This is Dr. K from PCH MedSpa. So this is a maintenance session every 3 months. What we do, we get the patient, we address things that the patients have concern with and the things that I see. So she's done her endolift, she's done her facial balancing with me. Okay, so she tells me examples. She tells me, I have a little laxity here, doctor, can we do another endolift? I tell her, no, you don't have to pay another 4,000 or 5,000 for another endolift. We're gonna do a fractional light scan here, which we did. And if you can look, she's got little grids on the face, which will thicken the skin over time, okay? She has pigmentation here. What do? I do the cool laser peel, and I put the boosters to get the pigmentation. Look at all this pigmentation she picked up from another clinic, and now she's here to fix. Dr. K, I want little lips. We did a little bit of lips for her, and she hasn't really seen her lips until now. My dear, take a look at your lips.
Mira sus labios.
You like the lips? Yeah? There you go. So, you need whatever you need. Frown for me here. Frown a little bit. Frown. Fronza.
Frunza su cara.
See? Whatever you need, a little Botox, we will do. We're gonna get the eyes a little fresher. I'm gonna put a little bit of Simon booster around the eyes. So, and then she comes back 3 months. When you do things over time, it will add up. Of course, she's already happy. That's why she's committing herself to come and do the maintenance with me. But I can improve the skin over time. And guess what? I told her about the copper peptide, the daily peptides that we put in the skin, inject under the skin. And that's going to help you with glow, hair, joints, all of that. And besides, we have all the full program for peptides: recovery, boost, lean, muscle gain, anti-aging, you name it, we have it. So we are getting into peptides much more this year, and definitely contact us for your consult. And it's great. It's a 3-month program, and we can really transform your body. Okay, I'm going to put myself, I've started myself on peptides, so 3 months I will show you the results. It's going to be very good, and you don't have to do it for more than that. 3 months is enough. But of course, you have to work out, you have to do the exercise, all that. So contact us for that. Any questions, you guys can comment. Suke is going to read it to me, but I'm going to show you the cool laser here. Here I did extra because I want to go a little deeper and get to the pigments, and that's why she's feeling more, because I've treated that area a couple of times already. Everything looks good. See, I did a little bit of the lip. I was hoping she won't feel because we did the lip filler, but this is good because it's gonna kind of improve the skin over the lip. So deep breath. Respira profundo, por favor. And that's it. She's gonna have nice fresh lips. Beautiful. So that's our cool laser session. Of course, we have to do now, we have to moist the skin because it's the cool laser. And I'm gonna put the bleaching boosters here. And I'll do a little Botox in. She's gonna be good. But what I see here, we tried to fix this before. This is the Marinette Shadow. What does it need? It needs a little bit of filler here. Okay, and it's improved, but still I'm not quite happy. So I'm going to show you how this is done now. It's super easy. You okay, dear? Good. So while she's doing this, getting ready for that marinade, see, I have all the boosters ready. This is Exosome, Salmon DNA, you name it, we have it here. And a little spray, my dear. So I'm going to hydrate the tissue while she's getting ready for the next step. So it heals quicker, and she gets a little bleaching out of it, but also I have to put the bleaching boosters here, which I will in a second. Look this way here. Yeah.
And this type of laser is the cool laser, also known as the Hollywood peel.
Hollywood peel cool laser. It's a very advanced machine from Germany. It does skin technique, it does peel, a lot of things that it does. So you can see now it's got a little hyaluronic acid also in here. There we go. and that's going to hydrate and hydrate the tissue because the lasers are the best. Also, if you have skin cancer, lasers will decrease the chance of skin cancer, which is pretty cool, right? In contrary to what some people think, lasers never cause cancer. It's the opposite. Of course, everything in moderation, everything with the experience provider. Okay, right?
And Dr. K, someone's asking what's the wavelength of the laser?
This is $24.95. Thanks for your question. Yeah, it's in about 2400 range. It's a halo laser or erbium YAG. Now we have the IPL, which is between 600 to 1000 or 900 wavelength. That's the intense pulse light IPL, right? So we do have that one. We do have some vascular lasers, which is like more around 400, okay? And then we have the Endolift, which is 1475. That's the one with that machine, right? And this is the gun that we used for her neck. So the neck had little grids already, it's healed, so it heals. But if you could touch it, you see a little bit of grid here, but that really tightens the skin. That's 1470 wavelength. And then from Endolift, we have 2400 range, 2495, something like that, which is the halo laser. And of course, next step is CO2, which is 10,000 nanometer wavelength. That's the highest, which we don't do. Usually we do a couple of cool lasers instead of a CO2. It's less downtime and it works better, unless you have so much wrinkling that you need that CO2 laser. Okay, so I'm going to show you how we're going to fix this. See, my dear, you have a little, see this?
Oh.
See, this side is better. This side I did a better job last time, but this side was probably swollen, so I couldn't catch it fully. So I'm going to fix this for you, okay? And then, yeah. Okay, so any other questions? Guys, this is a good time to...
The healing time for cool laser.
Hollywood peel, about a day, right? I'll be right back. About a day.
Okay, here's a little insight. So after the cool laser, your skin's gonna be a little red, just as you can see.
Yeah, she's gonna peel a little bit tonight, maybe tomorrow. But what we do is we cover the body with the face with Aquaphor, the body. We cover the face with Aquaphor, which is this guy, because this laser also, see how dry her lips are now? Now look what happens. I put the Aquaphor here, and I don't want to put too much because I want to treat this area. So I just want to give her a little bit of hydration, and it seals the skin, so that's what she's going to do. And she's going to have hydrated lips because we did little filler. And she's going to have a brighter and better quality of the lip. Of course, she has to use good lip balms, which I will give her. Any questions again?
Yes, someone asked, what is the best for jowls?
Okay, so for jowls, Endolift, right? Endolift, we can, Suke knows, we can really slim this down. She had some gels here. We will definitely share the before after if she gives permission, but this gel, so we go underneath and really slim down this area with Endolift. Then I put my fractional on top, then I improve the shadow. So it's a little tricky, but yeah, we can get it much better with almost like surgery.
And then the pricing for Endolift does vary.
Yeah, it starts at 3,000 and up, just depends, but usually we like to do a package for you. So she may have a little bit of bleeding, she may not because she had the laser, but that's okay. We go with tiny cannula. These are all advanced techniques that we don't poke you 10 million times. We just go with this tiny cannula, and as you can see, what I do is I go right where we need a little bit of volume and really improve this. Again, if she didn't have the cool laser, she wouldn't have any bleeding, but that's just pinpoint bleeding. So instant gratification here, because I know exactly where the problem is, but this is a very small cannula to give you the least swelling after, okay? And it's gonna take a little bit of time for me to do the fine tuning here, but that's why it's called fine tuning, because it's very, very minimalistic. So I improved the marinette shadow here. Even if you get a surgery, you need this shadow to improve. And you can see my tip of candle is right there now. Yeah, so we're filling this area very patiently and strategically. I'm just putting tiny amounts of filler here. She's doing really good. She's got a little vibration. You okay, dear? Okay, good. She doesn't feel much because it's got a little bit of a lidocaine in it.
This is the filler for everyone asking.
Yeah, marinette. This is the marinette fine tuning, okay? Because here the shadow will always be a little problem. So we go right under the skin and put the volume. Yeah, exactly. See, I am right where I want to be, and this is very superficial. Okay, a little massage here. Good. See, now much better. See, this was much worse than this one. Now this looks better, and we have to do a tiny bit here, and then we'll be good. Okay, so let's fix that. Again, the maintenance for our patients is discounted because we want to do everything, and we already know what patient did before, so it's a good way for us to make sure patients don't go elsewhere and get, you know, the treatments that are not right. So see, now the skin is a little bit pigmented extra, but that's okay. That's after the cool laser. I'm gonna put the WCPR here, which is the brightening, or I'm sorry, the bleaching booster. That's gonna help her. And the face will tend to swell a little bit after cool laser. That's fine. That's the nature of the beast. That's all good. So we put this bad boy here. See, I want to put a...
Yeah, she's awake. She just has her eyes closed.
Yeah, she's awake. She's fine, right? Todo bien. See, everything good. Yeah, I really want her to take the copper peptides home, but I think she's scared to inject herself. That's my guess, because she's not that excited about that. Look, that's all we need right there. Okay, and that's already a little bit settled down, and we can always improve it next time when she comes back. But this is already good. Yeah, this is good. So a little bit of filler here. Look at that. Good.
This is part of a package that she did. She already did the endo lift, so this is her follow-up package.
Yeah, now the lips look better. I'll just do a little touch of Botox for her. Again, this is combining lasers, little filler, Botox, boosters, and all that jazz. Just a little bit more of booster here. Okay, good. Now let's do her Botox and she'll be good. Okay, any other questions, okay?
Someone said how much is this expensive, so it just depends. This is part of a package that she purchased.
Yeah, this is a maintenance. This is usually less than $1,000 for the whole thing. Okay, and it's every 3 months. But you cannot start with this unless, well, usually you start with a big package. You know, we kickstart the body, the face with Endolift, Morpheus, Halo Laser Fraction. We do the big laser session. Then we do a fine tuning, which is all fillers. Like for example, she's got a little bit of cheeks, she's got a little bit of jawline, You know, now she's swollen up, so the definition is gone because with the cool laser, people swell up for like a day or two. Now, 3 months later, she came back for the maintenance. Okay, the maintenance is less than 1,000, heavily discounted for us, but it's for us really to keep the skin moving and also introducing new things that we didn't do. For example, I'm going to tell her, hey, why don't you come for a Cosmoland peel for this pigmentation with my nurse? Or why don't we do a PRX peel next month? So small things in between also we can throw in. And that's what I'm going to talk to her. So we do a little peel. Once a month is really good if we can do something once a month. Now for the Botox, I go with a very, very tiny needle because my patient already had the laser, So we want to just do this, we call this meso Botox. So very tiny amount, and just put a little bit just to kind of keep the wrinkles away, and with this needle, usually there's no bleeding. Okay, raise it up, up, up. So the lines, okay, just a little touch up, guys, and again, this is a exclusive thing that we offer to ensure patients are getting their skin keeps rejuvenating and they get a little bit of improvement each time, okay? Because over time things will really get better. Yeah, just a little bit here, my dear. Can you smile? Show me the lines. Okay, so see, she's got little lines here. Now this is all advanced technique where we do a little meso. Good. And then smile on this side. Okay, good. Yeah, just get the mesotox in so she's nice and good. And then one area I really like is the DAO. So this muscle here, we go deep, inject it. And same here. And that's gonna, guess what this does? Helps with the gel. Okay? Because it's gonna release this muscle and she will be like this about a week from now. That's the DAO treatment. And of course, sometimes we do Nefertiti lift for the jawline lift, but she doesn't need it. She got the endo lift, she's got very nice lift already.
Okay, to everyone asking, we are located in Newport Beach.
Yeah.
So, very nearby to everyone here in California.
Yes.
And we do have patients that come from Canada, from the Bay Area, Texas, Arizona, you name it.
Oh, we also have a clinic in Arizona.
Yes, we do. To anyone
Fountain
that's...
Hills Med Spa, yes. In Fountain Hills, and now we've treated the skin. We've got the boosters, we've got the healing boosters, and I'm gonna put a little hyaluronic acid also on her with Exosome. That's gonna hydrate her more.
And someone's asking what was the length of the needle that you use for the Botox, the small needle.
Yeah, very short, like half an inch or something. That's probably a injector or doctor asking, but yeah, those are very specific needles that I get from specific sources. It's for meso injections. A lot of things we do here, even some doctors, they don't even have a clue what we do. We do carboxy. It's a facial with oxygen, not oxygen, with a gas called CO2. So let's put the mask on her. She's doing great.
Okay, muy bien. Wow.
Yeah, but that's a very, very short needle. I see it didn't cause any bleeding. Yeah, and these are cooling masks that we like to hydrate the face with before a patient goes home. I'm jealous. I wish I could do this. I cannot get this. These are things that I do. I cannot do it to myself, but maybe I'll ask Suke to do an oxygen facial for me today. Okay, that's the other thing that our girls do here, oxygen facial. It's called Oxygenio. So
Oxygenio.
yeah, you get bubbles, like a bubble facial, So we're gonna stay tuned. We're gonna do another live and show you that one And these are the best masks that I get from my Korean friends, and it's really good stuff.
Yes, Dr. K gets Botox.
I inject myself usually with Botox. That's the only thing I can do, which works fine usually. That's it, guys. Okay, see you soon. Ciao.
Bye.
Bye.